Continuing on this theme of looking at impacts on consumers, workers, other stakeholders, we have Teniope Adewumi-Gunn, who is a doctoral student in the Department of Environmental Health Sciences, and is working on a project looking at worker exposures in hair salons. I think a really great example of the Center for Occupational Health and students looking at direct impacts on important populations.
Hello. I guess before I start, I want to sort of preface in that I really believe that a lot of the things that we know about the adverse health impacts of chemicals and toxic chemicals really comes from worker studies and workers. And so while I'll be talking about salon workers, I think really thinking about farm workers and pesticides, thinking about sort of oil and gas workers, and also thinking about cleaners, house cleaners, things we know about occupational asthma. So I started this work about 2.5 years ago, working with an organization called Black Women for Wellness. And we did a focus group, and one of the participants was talking about her friends not having fingerprints anymore, her fellow salon workers, and not being able to go to the DMV and put them down. And when I first heard that, I was completely shocked, and I was like, that's not true, that's not correct, that's weird. And actually talking to folks who do nail salon advocacy work, this is a common theme. They've heard things, products so corrosive that they're really damaging to, just general fingertips and fingerprints of workers. So really, really important work to look at the folks who are most impacted with a lot of these chemicals that we are just sort of letting go through. So a little about salon workers. There are about 1.2 million folks employed in the sort of beauty industry, so that includes barbers, nail salon workers. In California, we have about 129,000 nail salon manicurists, 300,000 licensed cosmetologists. In Los Angeles County alone, there's about 60,000. So it's a pretty substantial population of workers, mostly female, of reproductive age. Some salon work tends to be low wage, depending on the area. Areas like Beverly Hills and things like that, a little more pay. And then independent contractors. So salon workers are independent contractors for the most part, often misclassified situations when we look at sort of nail salons where they're saying, these workers are independent contractors when they're actually employees. And that comes into play a lot of times when it's like, whose job is it to educate workers on the impacts of toxic chemicals to their health? And often women of color and immigrant women. And it's really great to sort of watch that video from Chemical Entanglements, and it talks about just how many chemicals we interact with on a day-to-day basis. And so when we look at salon workers, it's, I like to call it this sort of toxic soup, right? They're working with hairsprays, glues, developers, working 8 to 12 hours a day. Really have talked to salon workers who work almost 7 days a week, and really impacted with chemicals like formaldehyde, toluene, styrene. When we talk about fragrance, which is sort of this general term for thousands of different kinds of chemicals, and folks who are really, really impacted on a day-to-day basis with these chemicals. And there's not enough research. There's always never enough research. But the research we do have when it comes to sort of cosmetologists, hairdressers, looking at dermatitis, and another study just came out 2 days ago finding sort of chronic dermatitis with this population. Asthma, breast cancer, miscarriages, low birth weight babies, really seeing a lot of these adverse health impacts for this specific population. And then I want to talk about, I think we talked a little bit about who is most sort of susceptible, who are our most vulnerable populations, and really talking about how people use the products sort of these products, right? For example, people put hemorrhoid cream under their eyes for bags, and we don't talk about how people actually are using these products, who's using these products more. And looking particularly at Black women, who a lot of the products marketed and used by Black women tend to be the most toxic. And things like hair relaxers, highly corrosive ingredients like lye, potentially endocrine disrupting ingredients, seeing products marketed that have placenta in them. And, when we talk about using products from a very early age, and so you have salon workers who not only use these products on themselves, and so they have these impacts, but also using these products on their clients. And wondering sort of how do we do cumulative risk assessment for this specific population? How do we get data that's accurate? And there's just really a lack of research looking at this specific group. So organization that I worked with, Black Women for Wellness, started to ask these questions, really looking at Black women and specifically Black hair salon workers. And for 5 years, collected surveys, went out into the community, and this is when I first started to do sort of community participatory research, and asking people questions, which is for folks, I really encourage doing this sort of community-based research because, one, you have a whole new respect for things like qualitative research. It takes so much just to get a survey, and it's just whole new respect for folks who do that work. But talking to salon workers and really starting to get just some information on what's going on in their health. And we saw things similarly to what we saw in the research and literature: miscarriages, uterine fibroids, respiratory issues, skin irritation, eye irritation. And we saw there was this willingness to try to find alternative products that work, and not being able to find that. Also going and using these sort of tools, and I think we'll talk about the Good Guide and Skin Deep database, but those not having enough information on the products that women of color use, particularly Black women. So lack of access and information there. And then also willingness to spend more and definitely worry over these products. And one of the things we found very interesting is that the salon workers were more concerned about the health of their clients. And so they were sort of talking about, well, how will this impact my client? How will this impact my client's health? And not really sort of thinking about, well, how will this impact your health? Because you see so many clients and you're also using these products on yourself as well. And so really one of the first folks to publish that information, and we've seen this sort of collaboration of different research groups coming together to sort of ask these questions. And kind of moving forward, and we talked about policy and policy not being enough, and that's why looking at it from sort of policy and regulation, but also education, awareness, and research. And I want to talk about two policies that are going through the California legislature right now, and talked about sort of Assembly Bill 1575, which actually requires labeling of professional salon products. Which there's like this loophole where they do not actually have to be labeled on the container versus like your consumer products. And then Senate Bill 258 that requires ingredient disclosure, also includes fragrance disclosure of cleaning products, which if you like pick up a bottle of, I don't say Windex or something like that, and you look on the back, sometimes it just says water. And we all know that like, it's not water. And so these are two bills that are going through that I think are some good first steps for us to also as researchers be able to sort of figure out what are in these products to be able to start doing some really good sort of research on them. And then education and awareness. Everyone I talk to wants more information, and it's very interesting as these bills go through, and a lot of the opposition is like, people don't want the information, people don't want to know, you're going to scare them. And it's like, well, people do want to know, right? People want information, they want a way to know, do I really want to use this product? Do I want to bring this product into my home or into my salon? And then training in training and talking to salon workers on how to protect themselves. And then increased research on the impact of these products and these chemicals on specifically communities of color. When we look at, what demographic is using these cleaning products more, what demographic is using these hair care products for, things that are marketed to women of color around the world. And increased funding and collaboration. I think it's great to see folks from so many different aspects of particularly campus coming together to talk about toxics and impacts on gender and race and class and things like that. And then more research in green chemistry, alternatives, I guess also research more about regrettable substitutions, and we just really need alternatives that work. A lot of these workers know that this may not be the best thing for their health, but it works, and their clients are sort of demanding that, right? Their clients are coming back because, they achieved a result that they wanted to. So really finding alternatives that work. And I just want to really talk about some organizations doing some great things here in California and across the nation and even globally. Black Women for Wellness, the California Healthy Nail Salon Collaborative, and then Women's Voices for the Earth, who are all doing some really amazing stuff and just a little piece of a larger sort of, I think we're having an advocacy session later, and some of these folks probably talked a little bit more about the work that they do, but it just requires so much collaboration with research and advocacy and policy to come together. So with that, thank you.